Welcome to Medical Appraisals UK and thank you for taking the time to watch this video. This is a great place for videos on appraisal and revalidation if you are a doctor or a designated body. In today's video, we will look at a common query amongst appraisers. If you work overseas, can you include your supporting information from non-UK sources for your appraisal? Content of this video comes from Mythbusters at RCGP. Doctors may practice in settings where they do not require a UK license. For instance, they may work abroad, or they may undertake specific functions in the UK that do not legally require a license to practice. Where this is the case, it is at your discretion whether you consider supporting information from these practice settings in making your judgment. The GMC requirement is that your appraisal and revalidation portfolio should include supporting information about every part of your scope of practice that requires a UK license. Your RO has the discretion to consider supporting information from other settings in making their revalidation recommendation. It is appropriate to check that the content of such an event is applicable to your scope of practice rather than assuming that it will be acceptable. We recommend that you discuss any proposal to include any such additional supporting information with your RO in advance of your revalidation recommendation date. It is likely that clinical work overseas will have a significant overlap with clinical work in the UK. It is likely that clinical work overseas will have a significant overlap with clinical work in the UK. It may well be appropriate to include supporting information relating to work overseas when it demonstrates the quality of your reflective practice. If you are unsure, use your appraisal as an opportunity to reflect on what is appropriate and proportionate with your appraiser, and then agree it with your RO before your revalidation recommendation is due. Content: Mythbusters at RCGP. Thank you for watching this video. If you like the content here, please don't forget to like, share and subscribe.